Just give or go through a presentation that's with a couple of slides added. It is a presentation I gave in December at the mHealth Summit regarding the Collaborative Health Platform Project that was led by that Open, funded by USAID and PEPFAR. So the deliverable for the project was a design specification. We were to be looking at how interoperability standards could be embraced to support mHealth architectures and mHealth mobile healthcare application designs. We had a very clear marching order. We were not allowed to start getting into the standards development game. And by clear, I mean the sentence began with on pain of death, as I recall. So we were required to look at what was available and see the extent to which what was available could serve the purposes that we had to serve. So here's what we did, and this is my busy slide. And I mean, I know this is bad PowerPoint form, so now you know I know. This is a busy slide because this is where we really got busy. I also feel a bit like a lot of you were showing RHEA. I'd never heard of RHEA before. I have to admit, I don't feel like an old guy necessarily, except I'm kind of old school with regard to the way I do enterprise architecture, and that's using the ISO model, which is kind of grayed out here. The ISO model is that you have an enterprise viewpoint, an information viewpoint, a computational viewpoint, an engineering viewpoint, and a technology viewpoint. So you could look at an architecture from different lenses. It's the same thing, but through these different lenses, we'll call them different aspects of the architecture. So the enterprise viewpoint were the business requirements. And our business requirements came from projects that Instead is doing, and projects that Denby is doing, and projects that World Vision was doing in Zambia. And we, as Chris indicated, we went and found a common ground. So what use cases did all of these projects have in common? And we picked that one as one we were going to model just because we knew it had traction. And we also felt, quite literally, that we triangulated it a little bit because it was something that was genuinely common in all of these contexts. For the information viewpoint, I shamelessly stole from ISO and I stole from HL7, RHEA, and others that had mature information models, mostly because of that on pain of death thing I told you about before. So the information models, we made use of stuff that was already available. In terms of describing the computational viewpoint, we used sequence diagrams. That's a kind of UML diagram that I find quite readable and many folks can make sense of quite quickly. So this, as Chris indicated, these are the three viewpoints that are represented in the HESA framework, which is the healthcare information, health interoperability systems architecture, which originally came out of SIM. It's a European standard. This was then handed off to the folks at Mohawk. The folks at Mohawk made use of technologies from the usual suspects, as you see their logos on the right-hand side. And this is where they got very busy. Going through the process of doing the engineering and looking at technology stacks that actually could fulfill the design that was expressed by the business, the information, and the computational viewpoints. So this very busy slide is where we got busy. So I'm going to go through a really quick example, and I'm going to tell you the approach that we used. We actually decided, because it works so well, we didn't use use case diagrams, which are a UML construct that I'm not fond of at all, because I was using like a bubble diagram with a bunch of arrows, and I could never figure it out. We instead used use case stories. And use case stories work well because we named our characters and we had to go through real processes. And in fact, most of it was one of our characters. So we used use case stories. We then documented those use case stories using some UML constructs, like sequence diagrams, as you see, and object models. And then we handed it off to the folks at Mohawk College who did some of the engineering of it and looked at various technology stacks. So this is an example of our use-based story, a community-based care event, and there's MOSA, and MOSA is clearly a ways along their pregnancy, and the community health workers using a home phone to capture some SMS-based information. So this particular care event has got our community health worker, Grace, and most of the client. Grace is adhering to care guidelines, so there's something on her phone that's either leading her through the steps or there's an SMS conversation or something that is making sure that the Every Woman, Every Child guidelines from the WHO are being adhered to. She's capturing some readings, and basically if Moses' condition indicates that she should be referred, there's going to be a referral happen. If everything's according to oil, then there's just going to be a next scheduled antenatal care visit that's going to happen. So I can't read this, and I don't expect you to be able to read this, but from a cartoon standpoint, this is a sequence diagram, which is the UML construct. What I do hope that you can see is that there are a number of different participants in a particular workflow that are indicated by the lifelines, and that there are certain things that are happening. It starts at the top, it reads to the bottom, and there are conversations that happen between the lifelines. So our characters here are going through the process of authenticating Grace and authenticating that it's MOSA that's a participant here from the client's standpoint. Information is being gathered, is being communicated to a workflow engine and back into the EHRS, the electronic health record system. Then there's some evidence-based decision-making that's going to happen, and it's either going to be routine care or it's going to be a referral. And I've called out a particular piece here where the workflow engine is talking to the interoperability layer, which is talking to the shared health record. And let's expand that a bit. So again, I still can't read the sentence in the middle here, but what we're looking at are a new set of characters now, because the shared health record was an abstraction, and the HICS was an abstraction for all kinds of services they get called. So a client calls the health and interoperability layer, which talks to a terminology service and a client registry, and a provider registry, facility registry, and a shared health record. So we then handed this off to folks at Mobile, and they began to engineer this, and they took it to the next level down and said, okay, if these high-level diagrams are going to be able to stand up and go, what then do we need? And what roles will various pieces of technology play? And in what ways can we connect them together so that they can collaboratively do this piece of work? So service roles were defined. Each of these roles participates in various interactions, and the interactions were named and analyzed. So this is pretty small, but I can read it. So I'll go through just the various roles that were defined here with the demographic registries, clinical repositories, orchestration engine, security and audit services, consumer applications that might be talking to all of these, edge devices, which could be phones, they could be computers, they could be medical devices, anything that could send and receive messages. So certain patterns, invocation patterns were then developed that said, all right, if these roles are going to exchange information with each other, what information is going to be exchanged? How will that exchange happen? How will these roles work together to do the work? So they actually went through the process of doing this engineering. And they even went so far as to look at not only how those interactions would happen, but what standards-based messages would need to be exchanged between the participants. And then they looked at open source products that are out there that are potential candidates to do this. And they said, well, insofar as we've now broken this down into roles and interactions, if I looked at Mirth, how many of these things that need to be done to be a client registry does Mirth do? How many does OpenMRS do? It's a pretty credible candidate here. The NMI, OpenEMPI, and Mobile had its own client registry work, service that is built for its work in Canada. So it gave a very useful way to compare these one against another. It then looked at what architectural patterns could be used to do the technology part. So you could use a broker-based pattern. And this is what it would look like if you did. You could use a service bus-based pattern. I think that's what's being considered now with the mule product. And it looked at a hybrid and it said, well, there's no right answer or wrong answer, but these are what the attributes are. If you pick this pattern, it will work this way. And that was a useful way to look at this because depending on what's important to you, you will favor one pattern over another. I think Chris had a version of this slide that he showed earlier. But if you pick a certain architectural pattern, then that will lead you into the arms of a particular communication pattern. And again, certain message constructs work well for certain communication patterns. So it's really putting the puzzle pieces together, connecting the dots into a picture. So quite detailed diagrams were prepared for each of the various scenarios. And it was a bit of a permutations and combinations problem. But a number of key scenarios were looked at, and the trade-offs that each of those implied were documented in this particular scenarios. Various message sets were looked at. So if I have to do the PDQ is confirmation of the client ID. So if I do PDQ in HL7B2, this is what the message would look like. If I'm doing it in HL7B3, this is what the message would look like. And a direct comparison one against another. The use case scenarios were modeled using the messages. So basically, they did do some prototyping. They said, all right, well, if this architecture is such a great idea, let's see if it's still a great idea after we've tried to put it together. And of course, some things seem like a great idea until you do the prototype. So there was some useful insights that came out of that. Out of the analysis that was done, there were some things that really did seem to be the right course for the course. And given certain assumptions about what would be important and therefore which patterns would be preferred, there were some candidates that really did nominate themselves as good candidates. And that was all documented and posted up to the hub. There is a section there for this CHP project, and its full document set has been sitting since I think December, and therefore public comment. Happily, the entirety of this work is available for anybody to make use of, comment on, or extend if they decide that they'd like to take it to the next level. My understanding is from Frederick that there's every danger that USA and CAFAR would like to see this taken to another level. And so there's, I think, a concept note circulating around the table again. That's it for me. Any questions, please? Okay.
Document the assumptions that were taken in terms of what the trade-off preferences might be?
In some cases, yes. In some of the cases, it was they were engineering constraints more than assumptions, sort of going in propositions. One of them was we were looking only at open source products. So one of the truths is our field was narrowed right away to those products that you could download and play with and not have to pay for the privilege.
Great presentation. Thank you. I like the 5 dimensions of the ISO approach. I heard you say that HESA only took 3 of those dimensions. Did I hear that correctly?
Yeah.
Which dimensions did they do?
They looked at the business view, the information view, and the computational view. One of the things, and this project was also informed by a companion project that I was doing at the time did the same thing. I said, let's not get into the sometimes religious wars about technology stacks and specifics of engineering, but instead just look at the business view, the information view, the computation.
So my follow-up question is going to be the justification leaving the other two out primarily, which is pragmatism, avoiding controversial topics, saying clearly what you can say clearly and leaving the others alone. Is that it?
Actually, not just that. If you have any technology stack that satisfies the architecture defined by the first three, it will be interoperable with any other technology stack that also satisfies that. And that was one of the reasons. It didn't, it did get into all kinds of pitched battles to go to the next two elements of the next two viewpoints. It just didn't get you any further down the road in terms of defining what would be interoperable.
Thank you for indulging me. One last question. How is the engineering different from the technology? What's the difference?
The technology, quite literally, is this .NET, is this Java. The technology is which technology stack. And there is the same engineering could be realized in either of those. So the engineering is taking what is otherwise an information model and a communication pattern and saying, okay, this information indicates that I have to send these pieces of data. Here are the data types I'm choosing. Here's the particular.
So it's the implementation or deployment aspect of the other.
Yeah. So think of a constrained code set. That's what we do in the engineering side. I would be more abstracted than that in the information model. When I get that in engineering, I'll have to say, no, this code set.
Just as a quick aside, Sean and I spent a good part of the whole afternoon reading through that document. We took quite a bit of notes on it. I think it's useful to have a sidebar and talk about that a little bit.
That would be great. And in fact, if you wouldn't mind, I would love to have that posted back up to the hub. One of the things that's been a challenge is there's been a few folks that have posted back up to the hub. We've had offline conversations by the dozens, and only a small subset of that is comes from the public dialogue. Our fervent hope was that we would be helping create a bit of a commons. So to the extent that some of the assumptions don't hold up as well as we think they might, that would be an incredibly useful thing to put out in the public comments. People will appreciate that if you don't bake in those assumptions, some of these recommendations are not